Good evening, everyone, and thank you so much for taking some time out of your busy schedules to listen to this webinar. It is 4:30, so we're going to go ahead and get started. Before we get started, I would like to go over a few things. First of all, you are all muted on this presentation, so if you do have any questions, please feel free to type them into the box on the right-hand side of your screen. At the end of this presentation, if time allows, I will answer any questions that come in. Also, if for some reason I cannot get to your question, you will receive an emailed response. Tonight, the focus is on CAMBRA. I am sure most of you have heard of CAMBRA before. Maybe it is something you have wanted to bring into your practice but haven't had the tools and information to do so, or perhaps you've pieced together your own risk assessment system based off of self-research. Whatever it may be, my goal tonight is for you to walk away from this webinar not only understanding what CAMBRA is, but feeling confident with the decision to move forward in providing the standard of care to your patients. I'll begin by giving you some information about CariFree and who we are as a company, and then from there I will move on to discuss CAMBRA and a wonderful program that we have built to be simple to implement and very effective. During this time, I will discuss the different tools and treatment modalities we recommend. First of all, I would like to introduce myself. My name is Heather Schuyler, and I'm a CAMBRA consultant here at CariFree. I spend the majority of my time working with dentists, hygienists, assistants, and wonderful office staff who are looking for something different to offer their patients. Some practices are looking for new treatment options for their high-risk patients, while others are looking for a more structured system that will be simple to implement. I have worked in the dental field for 8 years, and I love being able to provide dental professionals with information and ideas that I believe will ever change their patients. I have been a part of CariFree for 3 of those 8 years, and the company has been around for 12. CariFree was founded by Dr. Kim Cooch. Dr. Cooch has been successfully practicing dentistry here in Albany, Oregon for about over 35 years. He recognized that dental caries really is the #1 disease worldwide and is passionate about offering solutions to his patients to lower their disease rates. He is the world's leading authority on ATP as it relates to caries risk assessment. All right, so on to CAMBRA. Let's get started. On a daily basis, I talk with dentists and their staff members about one common frustration. They have patients come in for their appointment and without a doubt every time have recurrent decay. However, their home care is great and they're very diligent with directions. This not only leaves the staff frustrated, but the patient as well. By utilizing specific tools we provide, you'll be able to narrow down what is causing their issue. For some, it may be a bacterial issue, some it may be diet, others may be going through this due to genetics or maybe their saliva pH. But simply put, by using CAMBRA and our risk assessment process, you will be able to accurately address the situation and lift this feeling of frustration off of your shoulders as well as your patients. CAMBRA, which stands for Caries Management by Risk Assessment, has become a standard of care. CAMBRA is a model that focuses on risk factors and offering patients a management plan to not only get them into a healthy state, but to maintain that state long term. There are several reasons why it's important to provide CAMBRA to patients. Doing risk assessment with your patients puts them in the driver's seat. It keeps them involved throughout the process as well. Also, it really allows you to look at the bigger picture and understand the factors that are driving the patient's current state. As I mentioned, CAMBRA is becoming and has become a standard of care, and I wanted to point out that over 130 dental and hygiene programs are teaching CAMBRA as part of their curriculum. Prior to it being taught in educational settings, dental caries was simply a disease of mutant streptococci and lactobacillus, which led to a great amount of filling cavities. Oftentimes, those patients would return with similar bacterial issues, which leads to a never-ending cycle. Now, the focus has turned to really figuring out why patients are going through what they are, so down the road, the problems do not occur. So let's talk about what it takes for CAMBRA to work in a practice. First of all, it is important to understand the 3 defining characteristics. When doing CAMBRA, the 3 characteristics are early risk assessment, diagnosis of caries disease process, and treatment with minimally invasive procedures. Second, it takes the whole team. When implementing CAMBRA into your practice, it is important the entire team is educated on caries risk assessment. The team should help develop the system from appointment scheduling to procedure fees. Some teams choose to start small and utilize CAMBRA forms and tools on just their high-risk patients. Then once comfortable with the new program, focus on their entire patient base. Third, know the objective. While it is easy to identify the patient with obvious caries lesions, the real intent of the caries risk assessment is to not identify these patients, but rather discover why they have cavities, what risk factors are contributing to their disease state, and what factors can be modified. And lastly, keep it simple. It is important to keep the treatment regimen simple for the patient. They need to be able to easily implement the behavioral changes in oral care products. A complicated regimen will result in confusion, overwhelming feelings, and in the end, non-compliance and failure. So for the remainder of the presentation, we'll be looking at our CAMBRA program. As I go through the forms and tools and treatment options, I will ask some questions to keep you thinking. Please feel free to answer these questions in the box on the right-hand side of your screen. For all of those who answer the questions, I'll make sure to get an assortment of samples to you in the mail tomorrow. Once again, the questions are answered on the right-hand side of your screen. The CariFree system is structured around the concept of CAMBRA. This system makes it easy to assess patients and is also very patient-driven. We're taking a preventative approach and asking questions to find out why patients continue to have a recurrence of decay. Based on the patient's risk level, a dental hygiene care plan is developed. Some brief motivational interview is used with a recommendation of preventative and therapeutic products to decrease the patient's risk. The form you see on the screen is called the CRA form. This stands for the Caries Risk Assessment Form. This is the first step in the risk assessment process. The top half of the form is designed to be filled out by the patient. The questions are not anything terribly invasive. Most of it's related to behavior in the form of yes or no questions and answers. Before patients begin to even start answering about their daily risk factors, they are asked 3 questions to really monitor their motivation level. The patient is asked if they're interested in making changes and discussing risk factors. By asking the questions, you can determine what patient's motivation level is and what it will be like through the entire process. After the first 3 questions, the patient goes on to answer the risk factor questions. I will list a few as an example. Do you take medications daily? Are you experiencing any dry mouth symptoms? It also asks the patients if they drink something other than water. Then it asks the patients about some more major health concerns, such as those who are going through or have gone through head and neck radiation therapy or patients with Sjogren's syndrome. This section of the form is great because once you see the patient's yes or no responses, it really opens up the opportunity to find out even more. Perhaps your patient marked that they drink liquids other than water throughout the day. Find out what it is that they're drinking. Is it soda? If so, this can open up another conversation about pH and the acidity of beverages. Possibly your patient has dry mouth symptoms. In this case, you can explain to them that because of the lack of saliva, it makes it very hard for healthy bacteria to thrive. And when it comes time to discuss treatment options, you can show them special options for their dry mouth symptoms. So that wraps up the patient-driven top portion of the form. The remaining questions are more clinical and directed for you to fill out. A member of your team will fill out these questions based off of professional assessment. Questions such as history of decay, white spot lesions, visible cavities are addressed. Once again, these are yes or no responses, simple and straightforward. The third and final section of the form involves a risk assessment tool called the CariScreen meter. In a moment, I'll shift the discussion to learn more about the meter. When using the meter, we are looking for a high or low score. High or low are the options for you to circle on the form, which wraps up the third section. After the sections are complete, the idea is to summarize all of the information given. If any of the 3 areas raise concern, you will circle yes. By transferring that information to the boxes in the risk identification section, you're able to determine your patient's risk level. All yeses would be considered your extreme risk patient, all no's is a low risk, and so forth. This wraps up the risk assessment form. Even though it takes some time to explain initially, it can be completed in about under a minute. Once the patient's risk level has been determined, we have a guide for what treatment products are recommended. This is an example of what the guide looks like. After I discuss the testing meter and our products, I will revisit this guide. Before I go back to the third section of the form and discuss the Caries susceptibility testing meter, I do have a couple of questions for you. Go ahead and respond to them in the box on the right-hand side of your screen. My first question is, do you think this risk assessment form would be a good fit for your practice? Also, my next question, Where would you have this patient fill out the form? In the waiting room or in the operatory? I will give you a moment. All right, thank you for all of your answers. I know some of you are still working on that, so feel free to continue to submit them. At this point, you're probably wondering about the third section of the form I keep mentioning, the CariScreen meter. I wanted to make sure the risk assessment form was explained in full, so now that it is, I will discuss the CariScreen testing meter. For those of you unfamiliar, the CariScreen is a 15-second chairside test that we use to determine what's going on with the bacteria in the patient's mouth. You conduct the test by using pre-moistened swabs and by picking up a sample of the patient's biofilm. We recommend the swab test is done on the patient's lower linguals, canine to canine. So let's talk a little bit about what this test is looking at. Many times, those who hear about the testimeter assume it measures pH or confirms decay. Neither of those is true. The meter is measuring the amount of ATP or adenosine triphosphate within the biofilm. Many of you might recognize that as an energy molecule, and here's how that works for us. Acid-producing bacteria emit 100 times more energy than healthy bacteria. So the numeric reading that we're getting from the meter is a measure of the activity within the patient's biofilm. A low reading, which is any number below 1500, lets us know that there is a low amount of acid-producing bacteria present. The high reading, any number above 1500, is alerting us that there is too much activity going on. Patients who have a high amount of acid-producing bacteria present will need an antibacterial agent in their treatment regimen. I mentioned in the beginning of this webinar that on a daily basis, I talk to dental professionals about specific patients who come to them with decay, saying they do everything the dentist asks and are compliant with brushing and flossing, yet still have rampant decay. The reality is their situation doesn't entirely come down to their home care, but more importantly, what's happening in their biofilm. We all know that the biofilm is a tight-knit community of bacteria that exists on our enamel. Historically, the disease model included two primary pathogens, mutant streptococci and lactobacillus. However, additional pathogens are being identified every year, and some 40 different bacteria have now been implicated into this disease. It is no longer just a disease of mutant streptococci, it's truly a biofilm disease. When explaining the testing meter and this test to patients, use examples that they could relate to. As an example, look at this test like a cholesterol test. If someone came in for a cholesterol test and it came out high, it doesn't necessarily mean that they're currently having a heart attack. It simply means that they are of high risk. And naturally, we would want to start taking steps to decrease that risk. The CariScreen is not always confirming decay, but is letting you know exactly who your high-risk patients are so you can offer them correct advice and treatment options. So looking back at the form, besides daily risk factors and professional assessment, the CariScreen test is one extra tool that can be used to really confirm the patient's risk. Not only can you use the tool to identify risk level, but you can use it to monitor those patients down the road. My next question I have for you is, would you use the CariScreen meter on all patients or just specifically your high-risk patients? Go ahead and write your answer in the questions box. Of the three defining CAMBRA characteristics we have covered are the risk assessment form and the diagnosis of the caries disease process. The last topic to cover is treatment options. What you see on the screen is called the CTX guide, which stands for Caries Treatment Guide. These are 5 key components that we know are beneficial and need to be included in treatment therapy. So the first one is pH neutralization. We make sure that all of our products have an elevated pH because we want to create an environment that acid-producing bacteria cannot survive in. An elevated pH is something that makes our products very unique from others on the market. There are so many different dental products with great components. However, oftentimes one key thing is missing, and that's an elevated pH level. Many products are unfortunately highly acidic. Next, we have our antibacterial, which is sodium hypochlorite. This is necessary for those patients who have a bacterial infection or a high meter reading. Of course, there is fluoride, which aids in remineralization, xylitol, which is in everything we have, and it's a natural sweetener. And our last component is nanoparticles of hydroxyapatite. This is a form of calcium and phosphate, and it aids in remineralization in addition to the fluoride. Those are the 5 components that we focus on and that you will find in our products. And also, this should give you a better understanding of how we name the CariFree products. Each one has a number in their name, and that number indicates how many of the 5 components it contains. The higher the number, the higher the level of therapy. This brings up another question I have for you. Do you talk to your patients about pH, and do you show them a pH scale? Go ahead and answer the question in this box. Thank you for your responses. If you're interested in something similar to what you see on the screen, let me know and I can email you a PDF version. Moving on to the CariFree products, we have an assortment of products. However, my focus for you this evening will be on our 3 main ones: our antibacterial rinse, non-antibacterial rinse, and a great gel that can replace your patient's daily toothpaste. Starting with the CTX4 treatment rinse, the component in the rinse that really makes it stand out from the rest is sodium hypochlorite, our antibacterial agent. We use a 0.2% solution, and by doing so are able to change the patient's biofilm and really kill off the bad bacteria. Also, it has an elevated pH of 11 as well as fluoride and xylitol components. The CTX3 rinse is considered an everyday maintenance rinse. This is ideal for patients who already have good oral health or for those who have gone through a series of the treatment rinse. They would use the CTX3 rinse to maintain the benefits they received from the antibacterial agent. The last product I'm going to discuss is our CTX4 Gel 5000. We recommend every single patient incorporate this into their daily brushing regimen. The gel consists of prescription strength fluoride as well as nanoparticles of hydroxyapatite. I think it is so very unique that you can find fluoride and nanoparticles of calcium and phosphate in one product rather than having to use 2 different products. It's something that you really don't see very often. All right, so that wraps up the 3 main products that we have. Before moving on to the last section of this webinar, my question for you is this: are you currently offering products to patients? And if so, are you open to trying new ones? Thank you for your fast responses. I'm going to move on to the last portion of this webinar. So let's go back and put this system all together. Using the risk assessment form, you can determine the patient's risk level. After that, we ask you to reference what is called the Caries Management Guide. From here, you simply find the column that matches the patient's risk level. In each column, you are given a recommended therapy option as well as a provisional or less aggressive option. Basically, what this is a quick way to figure out exactly what you're going to utilize to fix the patient's problem. Now, naturally, the patient has the option to decline treatment altogether, and sometimes that happens. But one of the things that we've done at the bottom of this form is include the statistical likelihood of new decay within a year should the patient go untreated. So you'll notice for our extreme risk patients, there's an 88% chance that when they come back within a year untreated, that they might have new problems around margins, interproximal decay, or white spot lesions, or some sort of issue that needs to be addressed. If a patient declines, and once again that does happen, it's fine. However, let them know that when the timing is right, you have some very successful strategies that work well on decreasing their risk. Having this guide allows the CAMBRA program to once again be very patient-driven. Our products are also pieced together in 3-month patient kits based off of risk level. So whether you choose to do a 3-month kit for your patients or you feel individual products would work best, you can do either or. All right. Well, I don't know about you guys, but all of this information is just so exciting to me. I really love helping teams implement this and customize the CariFree system in a way that fits best. It is definitely not a one-size-fits-all system. Every office is a little bit different, and we have set this up in a way that really can be effective in any practice. By using CAMBRA with your patients, you really get the opportunity to build a trusting relationship with them, as well as make significant changes in their oral health. It's about time to wrap up the webinar. I know that a lot of people joining in tonight answered questions as I went along, and I thank you for that. I do plan on getting in touch with all of the attendees tonight personally. If you do not want to be contacted, feel free to email me and let me know. Or if you're interested in ordering the CariFree system that includes our testing meter and products, or just individual products, please email me or call me and I'll get more information to you. It looks like I do have time for one question that came in. It's a great question, and that question addresses young children. The question is, are there risk assessment questions directed towards younger children? Absolutely. We do have a CRA form that is targeted for ages 0 to 5. Treatment recommendations are a little bit different based off of age. They include our fluoride-free gel and also our CTX2 spray. These products come in great young children. They are constantly snacking. It's great for moms and dads on the go who have young children that can utilize our spray for their children, or using the gel that's fluoride-free when they're too young to be introduced to it at that point. So we do have a risk assessment form for children ages 0 to 5, and then the one that I showed you earlier in the presentation is for ages 6 and over. All right, well, I thank you all again for joining tonight. I will be in touch with all of you, and I look forward to speaking with you. Once again, email me or give me a call with any questions. Have a good night.